So my name's Sara Munro. I'm currently now the Chief Exec at Leeds and York Partnership NHS Foundation Trust. We provide a range of specialist mental health, learning disability, autism services. I'm a mental health nurse by trade. That's what brought me into the NHS. And the reason I came into working in the NHS and mental health in particular is all down to my family, my background, and the route that I've followed has been very much influenced by those early experiences. So in particular, my big nana was a huge influence on my life. I spent a lot of time with her when I was growing up. That's my mum's mum. She was the eldest of 7 children in Salford, a really bright, clever woman who unfortunately never had the opportunity to finish her education. The family couldn't afford for her to stay in school. She had 6 younger siblings. She left school and had to go to work to bring in money and look after her younger brothers and sisters along with her mum and dad. So what she always kind of instilled in me is the importance of education. So any time I would spend with her, she would be, she'd be an avid reader of the news. She would buy me puzzle books. We'd do them together. It's all about that kind of stimulating your brain, learning and challenging yourself. So she's the reason that I went through the degree route as well, because you should never turn down the opportunity to get an education, to, I suppose, further your own opportunities in life, because she never had those opportunities herself. So it really mattered to her and what she wanted for me. And I followed that all the way through. When I did my PhD, I actually dedicated my PhD back to my big nana because it just felt so important. That was what she instilled in me, which is what drove me. And how did I end up working in mental health? So what I probably was less aware of growing up, but became more aware of as an adult, is how much mental illness had an impact on my own family. So my nana herself, she had 7 children, and my mum was the youngest. And when my nana was pregnant with my mum, my granddad, my nana's husband, he was detained into a psychiatric institution, as they were called at the time. I subsequently learned that he was diagnosed with paranoid schizophrenia, and the experiences and the impact on my mum's older brothers and sisters in particular was more profound than her, because he was never allowed to return to the family home. And Nana had to make a choice. If your husband comes back, all your 7 kids will be taken off you, or your husband doesn't come back and your children stay with you. And so my nana also then became a single parent for a significant part of her life. And what's really clear was how much mental illness was so little talked about, and the level of stigma around it. And even when I was choosing to go into the NHS, my mum was an auxiliary nurse at an elderly care hospital. She loved her job. That inspired me to want to go into nursing. But when it came to thinking, well, do I want to do mental health? So many people said, oh, no, you don't want to do that. And for very stigmatizing reasons. And that just made me more determined. Actually, this is the field I want to go in. I want to be able to work with people that I believe deserve the best possible care, treatment, and support, and not suffer the ongoing stigma and discrimination that I've seen witnessed through my own family, and obviously through my career, as well as what's impacted on the people that I've worked alongside over quite a number of years. What became really clear to me early on in my career, and is an area that has just grown in terms of recognising the awareness and understanding the impact, is the disproportionate access to good mental health services, and then the disadvantage in terms of outcomes, in particular for people who are from diverse communities. And when we think specifically around men, Black men from Afro-Caribbean backgrounds, and the overrepresentation of being detained under the Mental Health Act in the more controlled aspect of provision, so often in hospital or under community treatment orders, to a scale which just is not proportionate to the overall population. And that has been a feature well aware of throughout my career, and having worked in inner city areas, seeing that in terms of day-to-day lived experiences of our communities. I think what I've learned more so over the years, and especially into senior roles and working in partnership with communities, is these are deep-seated issues in terms of multi-generational. There isn't a quick fix. There's been lots of initiatives over the years. And I would say now, compared to the earlier part of my career, there's a much more shared understanding, acknowledgement and acceptance that this is a problem, and it's a problem within systemic in terms of mental health services, of where we're not getting access right into our communities at the right point in time. Um, but there's still a huge amount to do. And, I don't underestimate the level of commitment there is nationally and locally. Um, but what I will say is, in terms of where we're at with social media and the ability to influence and manipulate attitudes and misrepresent the communities that we're here to serve, I think the challenge is as great as it's ever been in terms of that wider understanding, and us then being able to ensure that we are designing and delivering services to meet the needs of our underrepresented communities in a way that means that they can get early help, early intervention, support at the right point in time in their local communities, tailored to their needs. And if we can do that, then that's the way that we can then stop this overrepresentation that we see in our inpatient services and for patients detained under the Mental Health Act. Um, but like I say, I think there's many different ways in which we need to tackle this. And as I sit here, the other thing I've learned is, my understanding and experience is not of somebody from, black male background, understanding what it's like to have tried to access services over the years. And what I've learned through some of the work that we've done in Leeds, through listening to some of our community organisations that have got feet on the ground, whether it's through football clubs, youth clubs in our communities, working with people to understand what it means to be able to identify being stressed, feeling unwell, ranges of emotions in terms of mental ill health, being able to articulate them in a way that means that you get the support that you need. That's where there's more that we need to listen to, respond to, and have people who have that lived experience, who are living those lives now, help design the services that are best placed to meet their needs. When I think about what role do we play, what can we do within my organisation to really make a difference, there's a number of things. One, of course, is us ensuring that all of our staff have that same shared understanding that I've just talked about, that this is a situation that we can do something about, that what we're seeing in terms of access to services from our local communities is not truly representative in the way that it should be. So some of this is around, so for example, in our community mental health services, working with people with lived experiences, voluntary community sector organisations, on what does it mean to have culturally informed care amongst all of our staff, and that's around skills, knowledge, who they work with other kind of community ambassadors that have got the right expertise and knowledge. In a number of our services, we employ people in roles, clinical inclusion leads, cultural inclusion leads that work. So, for example, in eating disorders, out into the community through faith organisations, through community organisations, to break down that stigma of mental health services and work with communities on bringing services closer to them and ensuring then that we can redesign our services based on feedback. So we're spreading that out across our services as well. In particular, when it comes to detentions under the Mental Health Act, our Mental Health Legislation Committee is chaired by one of our non-executive directors, Kenise Khan, who is a passionate advocate around diversity and inclusion. And one of the things, she's really clear in challenging us on is how are we tracking through our own, looking at our admissions data, what's happening in terms of detentions, where we're at, how is that then improving, seeing those reduced rates of detention through the work that we're doing, not only in the organisation, but with partners as well. In the past, we've made sure we've looked at enhanced training for mental health at hospital managers, in order so that they truly understand issues around race and representation, and what that means in terms of experiences of the Mental Health Act. So it's a number of areas really in terms of what we can do, but very much seeing that we can only make the right progress if we go to learn from and work with people in our wider partnerships that have got the right expertise, that are trusted in local communities in a way that perhaps traditional mental health and NHS services might not be seen as the go-to service for people in crisis, for instance. When I look to what I've learnt so far in terms of my career and the things that drive me in terms of my values and where I think that we should be making a difference in the services that we provide, for me, the absolute focus going forward is how do we redesign, transform how we deliver services and who we deliver them with to genuinely address the inequities that we see now in terms of who gets access to services, what does that experience look like whilst people are receiving care and support that they need, and how does that translate into improving the lives of people that we're here to make a difference to. That can sound, you know, bold and grand, and it is. And it should be, and that should be the things that we're here in leadership positions in terms of where we want to make the biggest difference. Work that I've got involved in over the past 6 months is through the Leeds Poverty Truth Commission, and that's a number of us as kind of civic business leaders meeting with community citizens and working together, looking at that direct lived experience of what it means to be a citizen in Leeds, and it's really humbling, but also takes me back to what I talked about in terms of my nana's experiences of what it can feel like when you've not got the same access and opportunities as other people in terms of your day-to-day life. And I believe as an NHS organisation, as a public servant, that our role should be to address those inequities in access and outcomes to serve our population. That's our population that we're here to serve, and that's what absolutely is our guiding principle. Working together and working collectively for me is about how do we work alongside our partners, whether that be our partners in public health, local authority, but really importantly through our voluntary community sector organisation and our local communities, in order to do that work I described, design and transform the way that we provide our services. People with the lived experience who are living in our communities have the most to offer in terms of what changes they want to see us making in the services that we provide. And I think it's really important to be able to do that in a way, and it's hard to do it in a way which is almost kind of not use the NHS badge is really important in terms of trust and confidence. But as big organisations, there's a risk that comes with it, which is to other smaller organisations and partners, it can feel domineering. So when I think about, we talk about allyship, not only is that about me and my interpersonal relationships and how I work with fellow colleagues in the city, wherever they're from, and whether that's service users, whether that's community ambassadors, whether it's colleagues in Touchstone or the GP Confederation. But it's also important what I see as my organisation, LYPFT, as an ally to all of those other organisations, of ensuring that we keep this mission and the commitment that we've made to the citizens of Leeds to address the overrepresentation as a priority for the city. I can help do that. I have a voice around the table to make sure it remains a priority for the city. And then in doing so, how do we, as a priority, make sure it's got the right resources, profile, and support from other organisations as well. So I see that very much on that two levels, as a strategic partner in the work that we're doing, but also that interpersonal, the way I behave and work with others is really important in terms of being seen as trusted and supportive, and using me and my kind of networks and opportunities that I've got to give a voice to the work that we're doing and support to others. So when it comes to talking more openly about racism and the way that we provide services and addressing the historic and systemic racism in the way that services have been designed, I think there's definitely more degrees of comfort in being able to talk about that and being able to acknowledge it, and say we know our services are not actually being seen as accessible or meeting the needs of different diverse populations, and there's something we need to do about it. Most definitely that there is. And something that I've learned over the past few years, both in the work that we've done through synergy and with partners in Leeds, but also internally within the trust through the Race Equality Network for staff, which I'm the executive sponsor for, is actually when I, as the chief exec, who's a white woman, am prepared to openly say and put in writing, racism is occurring and it's not acceptable, and to be able to name it and talk about it, and also be honest about times when it feels uncomfortable to talk about it. What I've learned through feedback is actually that enables, because of the position that I hold, enables other staff in the organisation or other people to go, it's okay to talk about them. And that's been insightful for me to think about, and probably partly helped when we did the board as well, reciprocal mentoring in the organisation. Because some things you can assume, and I think that comes back to the allyship. Sometimes if me saying something because of the title that I carry can enable others to have conversations in a way that they might not have been able to, then that's a really important space to be able to occupy. Know when you need to occupy that space, and I think that's why it's really important in Leeds, as us all as leaders, seeing the work that we're doing as a priority, as part of our Healthy Leeds plan, and keeping it there, is constantly reinforcing that message to others that these are the conversations we want people to get involved in, and the work that we want people